Welcome to the Deep Dive. We're here to grab a stack of info, dig out the real insights, and turn those dense topics into genuine aha moments. Today, we're taking a deep dive into a condition that affects countless horses, impaction colic. It's a frequent, often agonizing traffic jam in a horse's gut. And truly understanding it is critical for anyone who loves these animals or, is just plain curious about equine health.
It's absolutely crucial. We've pulled together comprehensive veterinary sources that meticulously break down the causes, how it's diagnosed, and the full spectrum of treatment strategies. What's truly striking is how often seemingly minor, sort of everyday factors can snowball into such a significant and painful issue for a horse.
Okay, so our mission today is to equip you with a comprehensive understanding of impaction colic, from recognizing those subtle early warnings to the cutting-edge treatments available so you can feel truly well-informed. Let's peel back the layers and see what we uncover. All right, so to really deep dive into this, we first need to lay the groundwork. At its core, what exactly is an impaction in a horse?
Well, basically, an impaction is an obstruction, a blockage, in a horse's gastrointestinal tract, their GI tract. You can sort of picture it as a solid mass of feed, maybe fecal material, or even something foreign getting completely stuck. Most often it happens in the large colon, and it just stops anything else from moving through. This blockage is what causes that intense abdominal pain we call colic.
So when you say obstruction, we're not just talking minor discomforts here, are we? Can these blockages become quite severe?
Oh, absolutely. They can range from partial obstructions, causing, significant discomfort, to complete blockages that are extremely serious. Our sources highlight that these traffic jams often occur at specific choke points in the large intestine. Think of areas like the pelvic flexure, which is a really tight U-turn in the colon, or the cecum, this large pouch that acts a bit like a fermentation vat.
Oh, okay.
These spots are particularly vulnerable, partly because they house their own internal pacemakers that help regulate gut movement. And if those get disrupted, things can really, really back up.
Right. Once we understand what this traffic jam is, the crucial next step is figuring out why it happens. What are the common culprits behind these impactions?
Yeah, that's key. And our sources show it's rarely just one single thing. It's usually a complex interplay of dietary factors, management, environment, and even horse-specific things that either slow down the gut or cause the contents to become abnormally dry and dense.
Okay, let's break those down. Let's start with diet. What should we be looking out for in terms of what our horses are eating or maybe not eating?
Right. Well, here's something that might surprise you. The most common culprit behind these painful blockages is often simply a horse not drinking enough water.
Really? Just water?
Yeah, whether it's, frozen water buckets in winter, or maybe the water tastes funny during travel, or just limited access. Insufficient water intake directly leads to drier ingesta. That's the material moving through the gut, making it much, much harder to pass.
That makes perfect sense. So a basic need, often overlooked. What about the feed itself? Is that often a problem?
Absolutely. Another big factor is the excessive intake of dry, coarse, or maybe indigestible feed. This includes things like poor quality hay or straw, which are very high in indigestible fiber and, crucially, low in moisture. Also, just large amounts of fibrous feeds, especially if they're not chewed properly, maybe due to dental issues, can create these large, undigestible chunks. And remarkably, even rapid changes in diet, particularly switching to high fiber or completely new types of feeds, can just throw a horse's system into disarray.
And I've definitely heard stories about sand issues leading to colic. Is that a common problem?
Yes, ingestion of sand or dirt is a huge cause, especially in sandy regions or, like you said, when horses graze on sparse pastures where they're picking up a lot of dirt with their forage.
Right.
These can form incredibly heavy impactions. I mean, imagine a tiny beach developing inside them. Sometimes it's just foreign material like bedding or, bits of plastic. And counterintuitively, diets that are actually too heavy on concentrates with insufficient fiber from hay or pasture can also predispose horses to impaction.
Interesting. So beyond what they're consuming, how do a horse's daily life and surroundings play a role? Their management, I guess.
Yeah, exactly. That falls under management and environmental factors. So reduced exercise or just long periods of stall confinement can significantly slow gut motility. I mean, think about how important movement is for our own digestion, right?
Completely.
Horses on stall rest are definitely at higher risk. Also, sudden changes in routine, stress from travel or competition, and even cold weather where horses tend to drink less and maybe get stalled more. All these things can alter gut function and lead to impactions.
Okay, and finally, what makes some horses just more susceptible than others? like inherently.
Right, these are the horse-specific factors. And here's an insight many horse owners might overlook. Your horse's teeth are just as vital as their diet in preventing impaction.
Ah, the teeth.
Yes. If they can't chew their food properly, those undigested chunks are, well, a literal recipe for a traffic jam. This is especially true in our senior equine friends. It's intriguing, actually, that both the very young foals, with what we call meconium impactions, and older horses are particularly vulnerable.
That's fascinating. Both ends of the age spectrum. What's going on there? What makes them so susceptible?
Well, for foals, meconium is their first manure, their first poop, and sometimes it's just too thick or sticky to pass easily on its own. For older horses, it's often a combination of things, maybe poor dental health, sometimes underlying age-related gut motility changes, or other illnesses just making them generally weaker.
Makes sense.
And beyond age and teeth, other factors include general pain or lameness somewhere else in the body, systemic illness or fever, and a significant one, parasite burdens. Heavy loads of certain parasites, like tapeworms or large, strong chyles, can cause inflammation or even physically block the intestines.
Wow. So it's not just about a horse's immediate health or what they ate today. It's a whole system perspective.
Precisely. A previous history of colic can make them more prone. Post-surgical adhesions, scar tissue inside, can cause issues. Even certain medications can be culprits. Drugs that slow gut motility, like some sedatives or opioids, can contribute. Even some common anti-inflammatory drugs, NSAIDs, if used in high doses, can play a role. And very, very rarely, it might be a subtle anatomical peculiarity they were born with.
Okay.
So yeah, it's clear this isn't just one simple problem, is it? It's a complex convergence of many potential issues.
Understanding these signs is crucial for owners, absolutely. But once they spot a discomfort, how do veterinarians typically go about diagnosing an impaction? What's the process?
Right. Diagnosing an impaction involves, first, a thorough collection of the horse's history, what's been going on, then a detailed physical examination, and then often specific diagnostic procedures to really confirm what's happening.
Okay, so what are the key clinical signs for an owner to look out for? Those big red flags.
Well, the primary sign is usually mild to moderate colic pain, and it can be intermittent, coming and going. You might see your horse looking back at its flank, maybe pawing the ground, stretching out, or repeatedly lying down and getting back up again. Restlessness.
Yep.
A lack of appetite is a major indicator, and significantly reduced or completely absent fecal output. Or maybe the feces they do pass are really dry, hard, or very small. If you're not seeing much poop, that's a flashing red light for an impaction.
Got it. No poop. Big problem.
Pretty much. Lethargy and maybe a distended, bloated-looking abdomen can also be present.
So once the vet arrives, what happens during that physical exam? What are they looking for?
Okay, so during the physical exam, the horse's heart rate might be normal or maybe slightly elevated. We check the mucous membranes, like the gums.
For dehydration?
Exactly. Their color and the capillary refill time tell us about hydration status. But a really key finding is often decreased or even absent gut sounds when we listen to the abdomen with a stethoscope. Normally, a healthy horse's gut gurgles and rumbles quite a bit. But with an impaction, it can be eerily quiet in there.
Wow.
That silence tells us the gut isn't moving as it should. Motility is down.
And beyond listening, what's the sort of primary diagnostic tool vets rely on to confirm an impaction? Is there one test that really stands out?
For many large colon impactions, yes. A rectal palpation is often the most definitive tool. The veterinarian inserts a gloved, lubricated arm into the rectum and can often physically feel a distinct mass. It might feel firm or kind of doughy or quite hard within the pelvic flexure or other parts of the large colon.
Yep.
The large colon itself might also just feel generally full and distended with firm material.
But I imagine not all impactions are found this way, right? Like,
Sure.
what if it's too far forward to reach?
That's an excellent point. You're right. Small intestinal impactions, or those very far forward in the large colon, often aren't rectally palpable. You just can't reach them. In those cases, other diagnostic tests become absolutely crucial. One common one is nasogastric intubation, passing a tube through the nose down into the stomach.
Right.
If there's significant reflux, meaning stomach contents come back up the tube, it can strongly suggest a small intestinal obstruction is backing things up all the way to the stomach.
Okay, so what other advanced tests might be used? And maybe more importantly, what's for the horse with each of these? What does it tell you?
Right, good question. Each diagnostic step helps build a clearer picture of what's going on and how severe it is. For example, a belly tap or abdominocentesis. That involves taking a small sample of the fluid that's normally in the abdominal cavity.
Okay.
Normally, this fluid is clear, maybe slightly yellow, but changes, like if it becomes cloudy or reddish, suggest inflammation or maybe even bowel compromise that the bowel wall is damaged. That immediately raises the alarm for a more serious issue.
So that changes the treatment plan.
Potentially, yes, or at least the urgency. Then there's blood work. That can reveal dehydration, electrolyte imbalances, or signs of bowel damage, like an elevated lactate level. A high lactate signals that the bowel isn't getting enough oxygen, which is a very bad sign, often indicating compromised tissue.
I see.
Abdominal ultrasonography using ultrasound can let us visualize distended loops of intestine or sometimes directly detect sand accumulation. And radiography or x-rays are particularly useful for identifying meconium impactions in foals or large sand accumulations in adults because sand and meconium show up quite clearly on the image.
Gotcha.
So the goal is really to piece together this puzzle history, exam tests to figure out the location, the likely cause, the severity, and ultimately determine the best and swiftest course of action for that horse.
Okay, so once an impaction is confirmed, what's the plan? How do you get the horse feeling better? What does that road to recovery look like?
Well, the primary goals are always, first, to rehydrate that stuck cecal mass to soften it up. Second, to stimulate the gut to start moving again. And third, of course, alleviate the horse's pain. The good news is that most simple impactions, the uncomplicated ones, respond really well to medical management.
Okay, good. So what's the absolute first step in that medical approach? What's most critical?
Hydration. Without a doubt, hydration is paramount. It's the single most critical factor. The most common and effective method is administering large volumes of water, often with electrolytes mixed in, directly via a nasogastric tube. We're talking maybe 6 to 10 liters at a time for an average adult horse, potentially repeated every few hours.
Wow, that's a lot of fluid.
It is.
Yeah.
Intravenous fluids and IV drip are also essential, especially for horses that are already significantly dehydrated when the vet arrives, and of course, just basic husbandry. Always ensure the horse has fresh, clean, easily accessible water. Even offering warm water in cold weather can sometimes encourage them to drink more.
Right. So basically you're trying to flood the system from both ends, orally and intravenously, to loosen things up. What about medications? What helps?
Exactly. And yes, we often use laxatives and lubricants, also typically given via that nasogastric tube. Mineral oil is a very common choice. It doesn't get absorbed, it just acts as a lubricant, making the impaction slippery and easier to pass.
Okay.
Actually, seeing mineral oil passed out the back end is often a really great sign that the blockage is resolving, that things are moving again.
A good milestone.
Definitely. For sand impaction specifically, psyllium, the same stuff humans use as a fiber supplement, is highly effective. It acts as a bulk laxative, binding to the sand and helping it move out. Magnesium sulfate, or Epsom salts, is another option. It's an osmotic laxative, meaning it draws water into the colon, which helps soften the mass. But it must be used carefully, only in well-hydrated horses, because it can actually worsen dehydration if you're not careful.
Right. Tricky balance.
It is. And another one is dioctyl sodium sulfosuccinate, or DSS. It's a surfactant, helps break down the impaction, but it can be a bit irritating to the gut lining, so it's used judiciously.
And managing the pain must be a huge priority throughout this, given how uncomfortable this obviously is.
Absolutely. Pain management is crucial, both for the horse's welfare and sometimes to help with diagnosis and handling. Commonly used anti-inflammatory medications, NSAIDs like flunixin meglumine, which many horse owners know as Banamine, are key for providing relief. Sedatives like xylazine or ditomidine can provide short-acting pain relief too, and they can make diagnostic procedures like rectal palpation easier and safer. Though it's important to remember they can temporarily decrease gut motility themselves, so their use needs to be balanced against that potential side effect.
Right. Are there any drugs that actually help the gut move rather than potentially slowing it down? The opposite effect.
Yes, there are. We call those prokinetics drugs that promote motility. Intravenous lidocaine, given as a continuous drip, can actually improve gut motility, particularly for small intestinal issues. And it has some pain-relieving properties, too. Metoclopramide is another option, often used for upper GI tract motility problems, though its effectiveness lower down is maybe less certain.
Okay. And what role does feed play during treatment? Do you just stop feeding them altogether?
Initially, yes. All feed is usually withheld to prevent any further material from accumulating behind the impaction. Don't add fuel to the fire, so to speak.
Makes sense.
But once the horse shows clear signs of improvement, they're more comfortable, Gut sounds are returning, maybe they've passed some manure. We gradually reintroduce feed. We start with small, frequent amounts of easily digestible, very wet feed, things like fresh grass if available, soaked hay pellets, or maybe a sloppy bran mash. Dry hay is typically avoided until the impaction seems completely resolved.
And what about exercise? You mentioned stall rest can be a risk factor. Can walking help during treatment?
Yes, controlled light exercise, like gentle hand walking for short periods, can indeed help stimulate gut motility. But, and this is a big, but only if the horse isn't in significant pain. You certainly wouldn't want to force a horse that's still showing obvious signs of severe colic to walk around.
Got it. So when does it move beyond this medical management to something more drastic, like surgery? When do you make that call?
Right, that's a critical decision point. Surgical management, going to surgery, is considered if medical treatment fails to resolve the impaction after a reasonable period, maybe 24 to 48 hours.
Yeah.
Also, if the pain becomes unmanageable despite appropriate medication, or if there are clear signs of bowel compromise developing.
Like those red flags from the belly tap or blood work.
Exactly. Things like a persistently very high heart rate, significant abdominal distension suggesting gas buildup that can't escape, or abnormal fluid found on that belly tap we discussed earlier, cloudy, bloody fluid, high protein, high lactate. Those are all signs the bowel might be in trouble. And certain types of impactions are more likely to need surgery from the get-go. Things like enteroliths. These are literally rock-like mineral concretions that can form inside the horse's gut, almost like gallstones, but in the intestine.
Wow. Actual stones.
Yes, they can get quite large, or very large, very firm sand impactions. These are often much less responsive to medical treatment and might require surgery right away to physically remove them. If surgery is needed, it typically involves an abdominal incision, usually down the center of the belly, a ventral midline celiotomy, to allow the surgeon to directly access the intestines and manually break down or remove the obstruction.
Okay, so once the impaction is finally cleared, whether it's through medical management or surgery, what's the key to a full recovery and, crucially, preventing it from happening again?
Yeah, the post-resolution care is vital. First, it involves gradually reintroducing feed, moving slowly back towards their normal diet, while meticulously monitoring their fecal output to ensure everything is working normally again.
Checking for poop again.
Always checking for poop. But perhaps most importantly, you absolutely must go back and identify and address all those potential predisposing factors we talked about earlier. That means ensuring thorough, regular dental care, making sure they have consistent access to fresh, clean water, maybe even adding salt to encourage drinking, improving the quality of their diet, ensuring enough fiber, implementing a proper parasite control program based on fecal tests, and ensuring they get appropriate, regular exercise and turnout. It's really about taking a holistic look at their management and fixing any weak links.
So wrapping this up, what does this all mean for you listening, whether you're a seasoned horse owner, maybe a vet student, or just someone fascinated by animal health? We've taken a pretty deep dive into equine impaction colic today. We've uncovered everything from those sometimes surprising everyday causes, diet, water, environment, even their teeth, to the detailed detective work of diagnosis and the critical treatment strategies that bring relief.
Yeah, and zooming out, what really hits home for me is just how incredibly connected a horse's health is to their environment and how we manage them day to day. A seemingly simple thing, like a lack of water access for a day or a sudden change in hay quality, can have these profound, really painful consequences. It underscores that early recognition of the signs and being proactive about managing those known risk factors we discussed are truly the keys to successful outcomes.
Exactly. And the good news is most simple impactions do respond really well to medical treatment, right? The prognosis is generally excellent in those cases.
That's right.
But it worsens significantly if complications develop or if surgery becomes necessary. So being well-informed, knowing what to look for, and acting quickly truly makes a difference.
Absolutely. And maybe this raises an important question for you to think about. Considering all those varied factors we discussed, how might a deeper understanding of those specific danger zones in a horse's gut, places like the pelvic flexure or the cecum where things tend to get stuck, how might that impact the way you approach daily preventive care for your own horses? Or maybe even just deepen your general appreciation for the sheer complexity and sometimes fragility of the equine digestive system?
That's a great question to ponder. We certainly hope this deep dive has given you a clearer, more nuanced understanding of this really common equine condition. Thank you so much for joining us on the deep dive. Till next time, keep learning.